Hello everybody, this is Dr. Kukreja Kalani and today I'll be speaking about the various congenital heart defects that are found in small babies at the time of birth. So it being an awareness week, that is from the 7th to 14th of Feb, it's an awareness week for the congenital heart defects. We'll be talking about what are the common signs and symptoms. The common symptoms that are found in newborn or children are basically labored breathing. Secondly, it is the cyanosis of the lips and the nails because of the poor oxygenation. Then the poor feeding. Because of that, there is poor weight gain. And upon examination, that is when you auscultate the child, there are additional sounds that are called as the murmur. So this raises a suspicion, and on investigation you will find out that there could be these defects. And what are the common defects which are found when we talk about the congenital anomalies? Congenital anomalies meaning that the defects which are found at the time of the birth, during the fetal development because of the genetic inheritance, or some chromosomal defects because of the environmental causes. There are structural defects which are found in the heart. So the common ones are ASD, that is the atrial septal defect, that is a communication between the two atrium. Then we have the ventricular septal defect, that is, these are the pumping chambers of the heart, and if there is a hole between the two ventricles, this could lead to mixing of the pure and the impure blood. That causes a problem. Then we have a condition which is called as where the left side of the heart is poorly developed, that is the hypoplastic left heart syndrome. Then we have the aorta, that is the main vessel which carries the pure blood to the different parts of the body. In some section of this vessel, that is in some section of the aorta, the vessel is narrowed. So because of it, again we have insufficient good oxygenated blood reaching to the peripheral parts. So these are the common defects which are found in small children and or the newborn babies. Now it is very important that the diagnosis and early determination of the disease is done, so that early intervention is possible. Because if the defects are minor, then it's okay, it can be handled, but if there are multiple defects, then it can lead to the high mortality. So it's very important that the symptoms can be checked upon, and early diagnosis leads to good results as well as a good prognosis of the case. And roughly we can say 1 out of 100, one in 100 children is diagnosed with this problem. So the parents have to be aware about the signs and symptoms, so that the right treatment can be started as early as possible.